At 2:13 in the morning, Megan Lewis woke up shivering so hard her teeth hurt. The room felt freezing. Her t-shirt was soaked with sweat. Her heart was pounding. And when she stood up to walk to the bathroom, the floor seemed to tilt underneath her. She thought she had the flu. By sunrise, she was confused, vomiting, and struggling to answer simple questions. By noon, doctors were telling her family that her blood pressure was collapsing, her kidneys were shutting down, and they might lose her before the day was over. It started with an infection. What killed her was everything her body did next. This is Plague Diaries. Every infection has a story, every outbreak a beginning. And this one begins with one of the most misunderstood medical emergencies on Earth. Most people think sepsis means a bad infection in the blood. That is close enough to be dangerous. Sepsis is not just the infection. Sepsis is what happens when your body responds to infection so violently, so chaotically, that it begins damaging itself. The immune system, which is supposed to protect you, floods the bloodstream with inflammatory chemicals. Blood vessels start leaking. Clotting goes wrong. Circulation breaks down. Oxygen stops reaching the organs the way it should. The infection lights the fire. Your body turns it into a collapse. That is why sepsis can begin with something ordinary. A urinary tract infection, pneumonia, appendicitis, an infected cut, a kidney stone that gets complicated, a surgical wound. The source can be small. The reaction is not. Megan's story is a composite of real sepsis cases because the pattern is horrifyingly consistent. A day earlier, she had what seemed like a routine urinary tract infection. Burning when she urinated. Lower abdominal pain. Nothing dramatic. She figured she'd get it checked if it didn't improve. Then came the fever. Then the chills. Then the strange sense that something was deeply wrong. Sepsis often announces itself with symptoms that sound almost generic until you see them together. Fever or abnormally low temperature, fast heart rate, rapid breathing, weakness, dizziness, confusion, clammy skin, severe pain, reduced urination. The body is trying to compensate for a system under attack. The heart races because pressure is falling. Breathing speeds up because tissues are starving for oxygen. The brain gets foggy because the blood flow it needs is becoming unstable. And if this keeps going, the organs start dropping out one by one. By the time Megan reached the emergency room, she looked sick enough to scare people. She was pale. Her lips were dry. Her pulse was fast. Her blood pressure was low. When the nurse asked where she was, she answered correctly. When the nurse asked what month it was, she got it wrong. That matters. Confusion during infection is one of the signs that the crisis may already be systemic. Doctors moved quickly. Blood cultures, IV fluids, broad-spectrum antibiotics, oxygen, labs to check lactate, kidney function, white blood cells, clotting, organ stress. Because in sepsis, time is not measured in days, it is measured in minutes. Every hour that effective antibiotics are delayed raises the risk of death. Every drop in blood pressure matters. Every lost minute gives inflammation more time to injure the kidneys, lungs, heart, and brain. And sometimes even speed is not enough. There is sepsis. And then there is septic shock. Septic shock is where the crisis crosses a line. Fluids are no longer enough to hold the blood pressure up. The blood vessels are too dilated, too leaky, too dysfunctional. The organs are not just stressed now. They are failing. Megan's blood pressure kept falling despite liters of IV fluid. Nurses hung vasopressors, drugs that squeeze blood vessels and force the pressure higher. Her kidneys stopped making urine. Her skin became cool and mottled. Her lactate climbed, a sign that her tissues were running on emergency power. To the family in the room, it looks like everything is happening at once. Because it is. The infection triggered an immune storm. The storm damaged the circulation. The circulation failed the organs. And once enough organs begin to fail, death can move very quickly. This is why sepsis kills millions of people worldwide every year. Not because it is rare, because it is fast. Sepsis is terrifying because it attacks the body's infrastructure. This is not just one organ getting infected. This is the entire support system starting to break. Blood pressure falls, so the kidneys cannot filter. The lungs become inflamed and leaky, making oxygen exchange harder. The heart strains to keep up. Tiny clots may form where they shouldn't and fail to form where they should. The brain becomes confused, agitated, or unresponsive. The patient may look flushed at first, then grey, warm, then cold, alert, then unreachable. And because many early symptoms overlap with flu, dehydration, stomach bugs, or exhaustion, people wait too long. They try to sleep it off. They tell themselves they'll go in tomorrow. They think the danger will feel more obvious when it arrives. But sepsis often feels obvious only after it has already become dangerous. That is the trap. Modern medicine knows how to fight sepsis. It just has to get the chance. Doctors give broad-spectrum antibiotics fast, then narrow them once they know the source. They pour in IV fluids to support circulation. They use vasopressors when fluids are not enough. They give oxygen or place the patient on a ventilator if the lungs fail. They drain abscesses, remove infected tissue, place catheters, operate if the source is surgical. In other words, they do not treat sepsis with one miracle drug. They attack it from every angle while trying to keep the body alive. Some patients recover fully. Some survive but leave the ICU with long-term damage. Kidney injury, neuropathy, weakness, memory problems, PTSD, and some never come back out. That is the reality behind the word sepsis. Not a vague hospital complication, a full-body emergency. So what should people actually watch for? If someone has a known or suspected infection and they become unusually confused, hard to wake, short of breath, severely weak, cold and clammy, dizzy, mottled, or suddenly much worse overall, treat it as urgent. If they have fever, plus fast breathing, plus mental status changes, do not wait. If their blood pressure seems low, if they are barely urinating, if they look like their body is shutting down in front of you, call emergency services or get them to an ER immediately. Do not settle for maybe it's just a bug when the whole picture looks wrong. The phrase doctors and public health groups use is simple. Sepsis is a medical emergency. And unlike many medical phrases, that one is not dramatic. It is exact. Sepsis doesn't need a rare tropical disease. It doesn't need a medieval plague ship. It can begin with a bladder infection, a cough, a cut, a surgery that seemed to go fine. That is what makes it so unsettling. It hides inside ordinary illness until the body suddenly tips from infection into collapse. And once that happens, survival depends on speed, recognition, and luck. So remember the pattern: infection, fever, confusion, fast breathing, falling pressure, the sense that a person is getting worse by the hour, not the day. Because in sepsis, the scariest thing is not the germ. It's the moment your own body starts helping it kill you. If you survived this episode, subscribe, because the next one's worse. This has been Plague Diaries.